Can X-rays detect knee joint degeneration effectively? When it comes to diagnosing knee joint degeneration, especially osteoarthritis, X-rays are a commonly used tool. They provide clear images of the bone structures in the knee, allowing doctors to see important signs of degeneration. These signs include joint space narrowing, which indicates the loss of cartilage that normally cushions the bones. Another indicator is osteophyte formation, which are bone spurs that can develop around the edges of the joint. Additionally, X-rays can show subchondral sclerosis, which is increased bone density beneath the cartilage, and subchondral cysts, which are fluid-filled sacs in the bone near the joint. For the most accurate assessment, weight-bearing X-rays are often taken while a patient is standing. A specific angle, with the knee bent at about 45 degrees, known as the Rosenberg view, is particularly effective. This positioning helps reveal more pronounced joint space narrowing, which is crucial for evaluating the severity of osteoarthritis. However, it is important to understand that X-rays have their limitations. They do not capture soft tissues like cartilage and ligaments, nor can they detect early inflammatory changes within the joint. Therefore, while X-rays can effectively show structural changes in the bones related to knee osteoarthritis, they cannot visualize cartilage degeneration or early disease processes. For those aspects, other imaging methods such as magnetic resonance imaging may be necessary. In practical terms, X-rays are quite effective for confirming the presence and extent of knee joint degeneration once it has reached a certain stage. They assist healthcare providers in making treatment decisions by illustrating the degree of joint damage. However, they might not be as useful for identifying very early or subtle changes in the soft tissues of the joint. From the perspective of managing osteoarthritis, X-rays are a vital diagnostic tool. They are widely available, cost-effective, and provide essential information about the bony structure of the joint. Often, doctors will combine X-ray findings with clinical symptoms and, if necessary, advanced imaging techniques to gain a comprehensive understanding of the joint's health. In summary, X-rays can effectively detect knee joint degeneration in terms of bone changes and joint space narrowing. However, they are limited when it comes to assessing soft tissue damage or early inflammatory changes. Therefore, they should be part of a broader diagnostic approach that considers the patient's symptoms and clinical context. Always consult with a healthcare professional for personalized medical advice.